Hello, and welcome to part one of another roundtable discussion from BGI Genomics. In this series of videos, we'll be focusing on the management of hereditary cancers within families. We're honoured to have two experts joining us, Dr. Ahmet Uludağ, Chairman and Responsible Manager at NGC Genetic Diseases Evaluation Centre, and Professor Gary Liu, the Chief Scientist at Southern China Medical University. Our discussion today will delve into various aspects of hereditary cancer, including understanding how hereditary cancer differs from sporadic cancer, exploring common tumour susceptibility gene mutations associated with hereditary cancers and their specific linkages, determining the appropriate candidates for genetic testing in clinical practice, and examining the current landscape of genetic testing methods available for hereditary cancers. I hope you'll enjoy this insightful discussion with our panelists as we seek to unravel the complexities surrounding hereditary cancer and its management within familial contexts. Thank you both for joining us today. Can you maybe both just introduce yourself briefly, first of all? Professor Liu, let's start with you.
I came back from the United States. I once worked in the MD Anderson Cancer Center for 9 years before I retired. So hereditary cancer is my professional interest. And I came back from United States and work now full-time in China.
So we have Dr. Liu's intro. So Ahmet, can you introduce yourself as well, please?
Yes, I'm Dr. Ahmet Uludağ. I'm MD and PhD, also associated professor on medical genetics. I live and work in Turkey. I'm the founder of NGC Genetic Diagnosis Center.
Excellent. So how does hereditary cancer differ from sporadic cancer?
Regardless of its etiology, cancer is a genetic disease. We know that. And hereditary cancer is caused by germline mutations, often follows an inheritance pattern within a family. And sporadic cancer is caused by somatic mutations, we know, and interact with environmental and does not show any family inheritance pattern often.
So could you tell us more about some of the common tumor susceptibility genes that are associated with hereditary cancers?
Of course, there are several common tumor susceptibility genes associated with the hereditary cancers. Some of the most well-known ones are BRCA1 and BRCA2. You know, these genes are associated with increased risk of breast, ovarian, and other cancers. And TP53 mutations in this gene are linked to an increased risk of several types of cancer, including breast, bone, and soft tissue sarcomas also. And APC mutations associated with the increased risk of especially colorectal cancer. And MLH1, MSH2, MSH6, and PMS2 mutations are also linked with increased risk of Lynch syndrome, which is associated with colorectal, endometrial, and other cancers. And PTEN mutations is also the gene is associated with increased risk of breast, thyroid, and other cancers.
Yeah, that's the most common of the gene associated with hereditary cancer. I think we should understand some rare genes with the pathogenic mutations that can be detected in some hereditary cancer. For example, and lately I found a patient who is 56 years old and had cancer, had 3 cancers in 1.5 years, and his family have 7 cancer patients. So I'm sure that his family have a hereditary cancer, but accordingly, and other tests, the company that have a test that did not find any mutation in any gene. But I believe with this family is a hereditary cancer, and then do another test with the panel. So I found out a CETR mutation that usually associated with the fibrosis. So they detected in a patient who has 3 times the cancer. So ensure that is hereditary cancer family.
So, what types of cancer patients should undergo genetic testing for hereditary tumor diagnosis in clinical practices?
Genetic testing for a cancer patient to diagnose hereditary tumor is a complex decision, and it should be done carefully in consideration of the patient's medical and family history. Detection of germline mutations in tumor susceptibility genes by genetic testing in blood sample can make diagnosis of hereditary cancer, and individuals with a family history of a cancer assessed risk of hereditary cancer need professional cancer genetic counseling for tester and family members. Patients, especially if they were diagnosed at a young age or if they have had multiple primary cancers, or bilateral or rare type of cancers, or can help make a diagnosis of hereditary cancer, guide treatment decisions, assess risk of other cancers. And genetic tests for hereditary tumor diagnosis is often recommended in clinical practice for certain types of cancer. In particular, individuals with a family history of multiple cases of cancer may be candidates for genetic testing. For example, genetic testing based on family history may be recommended for certain types of cancer, such as breast cancer, ovarian cancer, colon cancer, or thyroid cancer. And guidelines contain different criteria for requesting hereditary genetic tests for many types of cancers. In here, I won't talk about all these in detail because it's a very detailed table, but it's important to know the criteria are becoming more liberal with each published guideline year by year. And it's predicted that more people will need to take these tests each time in near years.
Yeah, taxes is very important, and so I think we should understand in some cases and de novo mutation in some genes in some patients. It's a rare disease, a rare cancer. For example, lately I have a woman who have a have a second baby, and after the baby have in the blood of the regional, and for 3 years to make a diagnosis is a cancer regional myeloma. And this is why I believe because it's rare regional myeloma, so I do the genetic test and with the blood test and so find out have a CDKN2A mutation associated with myeloma, hereditary, hereditary myeloma. So when a rare cancers happen in one patient, we should be careful to make a diagnosis uh, to have a draw the blood to test if we have a genetic testing germline mutation in the gene.
So, what types of genetic testing methods are available now for hereditary cancers, and what influences your decision over what kind of test to use?
Hereditary cancer can be detected through various genetic testing methods. Some of the commonly used genetic tests are, first one is targeted mutation analysis. This is focused on a specific gene or specific mutation that's shown in the patient's relatives, or it looks for specific mutation with these genes, like specific syndromes like BRCA1 and BRCA2. And the other is panel testing. It involves testing multiple genes associated with various hereditary cancer types simultaneously. It's particularly useful when there is a suspicion of a hereditary cancer syndrome, but the specific gene is unknown, like Leach syndrome. Or whole exome sequencing, WES. WES involves sequencing the protein coding regions of an individual's genome to identify genetic variations that may contribute to hereditary cancer risk. There are hundreds of genes that associated with cancers, so we can see the protein coding regions of those genes in WES test. And whole genome sequencing. It's depends on the DNA sequence of an individual, all DNA, providing a comprehensive view of genetic variations that may contribute to hereditary cancer.
Yeah, that's very good. And I want to point it out and for the implementations, the genetic test, and then the PGT molecular test for the embryo. They usually sometimes they use the PCR with the genetic variance very clear. It shows the PCR test.
So, if you have a patient who's had a positive result for tumor susceptibility gene mutation, um, how does that change your recommendation for how you manage the treatment?
Patients who have a positive result for tumor susceptibility gene mutation require personalized management and treatment plans. It's very important for this patient to work very closely with a team of healthcare professionals, including genetic counselors, oncologists, and other specialists like psychologists, etc., to develop a comprehensive care plan. Some potential recommendations for the management must include first, increased surveillance. Patients with tumor related gene mutations may require more frequent screening and surveillance for cancer, such as mammograms, colonoscopes, or MRI scans, depending on the specific gene mutation. It depends on the mutation that cause specific cancers. And the second is risk reducing surgeries for patients, especially with BRCA1 and BRCA2 mutations. Risk reducing surgeries such as mastectomy or oophorectomy may be recommended to reduce the risk of developing cancer. And third is targeted therapies. Some tumors dependent genes mutations may make patients eligible for targeted therapies for clinical trials that specifically address their genetic profile. And the last, maybe the most important, is lifestyle modifications. Patients may benefit from making lifestyle changes, such as adopting a healthy diet, regular exercise, avoiding tobacco and cancerogens, alcohol consumption, and reduce their overall cancer risk. It's important to note that management recommendations will vary depending on specific gene mutation, type of cancer, and individual patients' factors. Therefore, it's crucial for patients to seek guidance from healthcare professionals who are special in cancer genetics.
So, when a family finds out that they have a hereditary cancer risk, how do you manage the entire family's sort of process for testing and the same kind of decision making through that?
Let me give the answer it's, uh, and show me what I have been doing for the family cancer. I think there are three parts for the family of with the hereditary cancer. The first part is the cancer patient. And the person who already have a cancer, personalized treatment is very important. And then after the treatment and follow up the cancer recurrence management using the MRD is very important for the recurrence happen. And also we need to pay attention for the new primary cancers, different new primary cancers mandatory, what in early diagnosis and treatment. And then another thing is like a sporadic cancer, the same thing. The therapy-related leukemia should be a major thing to be considered, to pay attention to it, because the therapy-related leukemia is difficult to treat. And this is the second part. This is the first part of the first group or the patient. The second group is carrier. The patients uh, with the mutated gene is a carrier, but doesn't have any cancer happen. So the tumor occurrence management is very important and tell and guide the carrier how to how to find the syndrome that associated with the cancer development. So there's a very much. I have one person. I have so many cases like this, and one patient with the black one. The black one is the mutation, the pathogenic the mutation, and then after she came to my clinic to have a genetic counseling. I tell her and how to manage it, what time the cancer should be take, particularly to take care a patient to the occurrence. And after she went home, that in 2 months she told me, and well, Dr. Lu, I lately I don't I feel bad and I don't have a good feeling. I thought I asked her what happening, and because of the black one the mutation associated to breast cancer, and also secondary the common is ovarian cancer, and she told me no, my breast doesn't have anything that it happens. It's normal, but my cycle is not regular, and the color is a change and also have pain. According to this happen in this present the critical information and ask her to go to have a test the CA125 and find out the CA125 increases 9 times their normal, and then suggested me asked her to go to the MRI and test it and find out have a mass and different mass in the ovarian, and I introduced it to cancer center and find out after the treatment diagnosis is early is the cancer happen. So it's a carrier for the carrier the primary cancers happen, how to detect, how to find out, and management is very important. This is the second thing we need to do, and also the third thing we do is, and for most of it is most person is carrier who is young, have and hope to have a patient or have a baby. So this is how to help and how to guide the carrier person to have a PGT, to have a non-cancer baby. And it means that don't let the mutations into carrier to carry to carry to transfer to the baby by PGT. That's the most important. And by PGT and non-cancer baby is very important things in the family when the hereditary cancer family management.
And in our clinic, when we have a hereditary cancer family, first we are giving genetic counseling to the family and offering genetic tests if need. This can help identify individuals who may be the risk for hereditary cancer and provide information on screening and prevention options. And after this, we are planning regular screenings. Individuals with a family history of hereditary cancer may need to undergo regular screening, such as mammograms or colonoscopies, etc. And the other thing is lifestyle modifications. As I mentioned, it's very important. Making healthy lifestyle choices such maintaining healthy weight, exercising, avoiding tobacco, alcohol, etc., can help reduce the risk of developing cancer. And the last and one of the most important is support and education. It's very important for families to have access to support and education about hereditary cancer, including resources of coping with the emotional and psychological impact of cancer diagnosis.
That's great. That's a good answer.